The member
Deputy
for
Speaker.
Southern River.
Thank you very much, Deputy Speaker. I rise to make a grievance to the Health Minister. And my grievance is to the Health Minister on behalf of Canning Vale, Gosnells, Huntingdale and Southern River and all of Western Australia, because we need more parking at Fiona Stanley Hospital. It is an absolute key. It's interesting your interjection there, Member, because your policy says that you wish to cancel the parking that I am seeking to fight for, that all of the Labor members, that all of the families from around Western Australia are seeking to do. But my grievance is not to you, Member, it is to the Minister for Health, because she is delivering on a very, very important piece of infrastructure in my community, and it is what I would seek to speak to today, Deputy Speaker. Minister, Fiona Stanley is an amazing hospital. My wife had a baby there. My wife, we had one of our children at Fiona Stanley. We had our other child at King Edward. Both amazing hospitals with amazing staff and amazing people. Again, Fiona Stanley is an amazing hospital, but there is not enough parking. We have an amazing set of services that are available. My electorate is sort of split. The different services that you would seek to go for. Half of my electorate generally, for a majority of their services, will go to Fiona Stanley. Some will obviously go to Armidale Hospital. But of course, there is the specialist King Edward Hospital. In Subiaco, there is obviously Perth Children's Hospital, but Fiona Stanley is a key piece of the health infrastructure in my community. And families tell me, and I've been door knocking and phoning, as have all of the South Metro members, but again, this benefits every member in the chamber, whether you're regional or metropolitan, because we all, and all of our families, use Fiona Stanley. We know that there is not enough parking at Fiona Stanley Hospital. And my grievance to you today, Minister, is to please, what can I tell my community about the parking plans that we will have? Can you also tell me the risks that the opposition might present in terms of trying to cancel plans for parking? I'm going to talk a bit about Fiona Stanley. Like I said, one of our greatest health ministers during the Gallop-Carpenter years, Jim McGuinty, not even he, I think, could have foreseen how popular and well respected our hospital would become at Fiona Stanley. There was great planning put into that complex, assisted by the train line and the public infrastructure and things that we have done to get there. During the Carpenter years, that was a key piece of planning. Change of government, obviously, under the Barnett government. It is in the Liberals and Nationals' DNA to attack our health services. We saw a number of services privatised there. A number of those things addressed by the McGowan-Cook government and Health Minister Sanderson, and I say thank you. But the Liberals and the Nationals have always sought to attack Fiona Stanley and attack the very, very popular and important health services that are there. You're saying that you built Fiona Stanley Hospital. You planned, you funded it during the Gallop-Carpenter years. I don't think that's the case. You did privatise the cleaning, the catering, the orderlies, the domestic assistants. You, at every opportunity when your side is in government, have attacked Fiona Stanley. I am hoping, Minister, that you can address the grievance that I am placing in terms of parking. Now, we have announced that we are going to relocate the Women and Babies Hospital to Fiona Stanley Hospital, and I think that is a fantastic move. It is a move that is endorsed by Western Australian families, by practitioners, health staff, nurses, families all across. Now, that is going to happen in years to come. That is an important piece of infrastructure that will happen. It's not going to happen tomorrow, but the planning and the significant investment led by the Minister is progressing for that Women and Babies Hospital to relocate to Fiona Stanley precinct when that time is right. What, Minister, my grievance to you now is we need the parking now. We need 2 multi-storey car parks built at Fiona Stanley Hospital. As I've said, Minister, I have been door knocking and phoning in my electorate for some time. I have to give a special shout out to Stephen Pratt in the Upper House. I speak on behalf of all of the members in this chamber whose families represent and access Fiona Stanley services. But a special shout out to Yasmin Barakai, to Kim Giddens in Bateman, David Scaife in Coburn, Lisa O'Malley in Bicton, Jags in Riverton. All of our families will access Fiona Stanley. We have a number of petitions which I will seek to table in this chamber, the hard copies that I have received, which is in support of the petition that the Honourable Stephen Pratt in the other place is pushing for, because the Liberal policy, as I understand it, Minister, and I would love if you could give further clarification of the Liberal Party policy, their policy at the next election, if they are elected, and this is the risk that all of my families need to know, the Fiona Stanley Hospital extra 2 car parks are moving forward. But the risk of that, 1 year from now, if the Liberal Party get into government, their policy is to cancel the car parks. That is what they seek to do. We need the car parks to progress. We need, in the next 12 months that we have, because I worry, as a local dad, I think everyone in Western Australia worries about what health will look like under a state and Liberal, but especially a state Liberal government. And my families need to know that you will not see car parks at Fiona Stanley Hospital. You will not see important infrastructure built. You will only see further privatisation and degradation of our services. Minister, I thank you for your service and for your team. You have an amazing Department of Health, and I would just like to say a special shout out to what you are doing to provide for my families. But Minister, what can I tell my families about more parking at Fiona Stanley?
Thank you, Member. The Minister for Health.
Deputy Speaker, thank you for the opportunity to respond to the grievance from the member for Southern River, and he touches on an issue that is incredibly important, and that is, people complain about parking, but parking is really access to healthcare, and so it is really important, and people who are unwell are often have disability or in some ways impaired, can't always get public transport. So parking at public hospitals is incredibly important. I do think sometimes that the portfolio should be called Minister for Health and Parking because they are so intertwined, and I am certainly I'm cognizant of how important it is because it equals access essentially. The member's absolutely right. Fiona Stanley Hospital has been hugely embraced, and 10-15 years ago when this was being discussed, people would say, clinicians would say, no one's going to work there. No one's going to go and work at Fiona Stanley Hospital. I remember the debate, and particularly from clinicians, no one will work there. And it is a bustling, fantastic, one of the biggest tertiary hospitals in the country. And so it is on a fantastic campus, complemented by a range of research facilities, by private hospital and outpatient services, as well as we'll have a health precinct with the Aegis building next door, which will also expand a range of services. So this is a really exciting health campus, which has room to expand and doesn't have the constraints that we have currently on the QE2 site. And Fiona Stanley, to give them a bit of a shout out, last year alone, 5,000 babies were born at Fiona Stanley Hospital. They're doing the heavy lifting of maternity care in the system. So 5,000 babies, or far more than was ever anticipated. They've exceeded the predictions and expectations, and including in one 24-hour period, 22 babies were born. That's like one every hour at Fiona Stanley. That southern corridor is growing significantly, and that's why, with the other services that it provides, the state rehab, the state heart, lung and bone marrow transplant service and the state burns unit, it is a world-class hospital servicing a growing community, which is why the vast majority of the community have supported the decision that we made as a government to relocate the acute maternity services down to that precinct. Now, it was essentially QE2 carried enormous risk to staff, visitor safety, parking constraints, impact on clinical services and disruption for up to 20 years on the QE2 site. When you contrast that with the Fiona Stanley site, essentially a greenfield site, there's a car park there where we need to build the hospital. Also, interestingly, the Nationals are very quiet about the Liberals' plans to scrap the plan to build the Fiona Stanley Hospital because they know it's better for regional women. They know it's better for regional women. We haven't heard a peep out of them about it. But we will, at the election, they are going to have to choose a side, because the leader of the Liberal Party has clearly said, without any rigour or even seeing the risk, she has still said she will build it at the QE2, cancel services, destroy buildings, with no plan to relocate any of those services to build the hospital there. But the Nationals are going to have to, at some point, say where they're going to build it. I could go on, but I'm going to focus on parking, because that is the key issue raised by the member. So let's just talk about parking for a minute. So before I outline the plan for parking for Fiona Stanley Hospital, let's talk about QE2. So the former Liberal government privatised the parking at the QE2 site, meaning that there's very limited, the government has limited term in what we're available to do with parking. The contract that was signed was incredibly restrictive. And handed control over to one private company to control the number of parking bays in our biggest and busiest health precinct. And it's a key constraint to why we can't build other hospitals down there. It's a key constraint for the research institutions that work there. Harry Perkins, the stroke, the really important stroke and neurological research that goes on down there. And during the construction of Perth Children's Hospital, all of the staff were shuttle bussed to Greylands because they couldn't find alternative parking on that site. Now, the Fiona Stanley Hospital offers a very unique opportunity. We own the land. We're not restricted by commercial arrangements or space. And because of that lack of constriction and owning the site, we're able to build 2 additional multi-storey car parks on that site. And so that will significantly increase the overall parking availability for staff and for patients. And that work is happening, it is happening alongside the hospital planning. So that is happening now. We have the Office of Major Transport Infrastructure working on that planning, looking at the road upgrades, doing that now. So we are not waiting until that hospital is built. Those multi-storey car parks will be built well before the hospital is built, so they'll be up and running well before. And as there'll also be significant upgrades to transport and other road infrastructure around that, and to provide better end of trip facilities. And I do want to provide some comfort to the staff at Fiona Stanley Hospital. The building of the Women's and Newborns Hospital down there will not reduce staff parking for staff at Fiona Stanley Hospital. It will not reduce access to staff parking. And the Chief Executive is working with the other parking providers around the campus to ensure that staff still have access to parking during construction, because we will have to close off those bays to build the hospital. But we are cracking ahead with those extra car parking bays, and I know it not only affects people accessing care, it affects local residents who find people parking in their streets as well. So we're taking this very issue, and the very real risk, remember, as you outline, is the Liberal National Government who will cancel those plans, scrap those plans for additional parking at Fiona Stanley Hospital, and maintain a continually constrained site at QE2 as well.
Thank you, Minister.